everybody. Welcome you all. Medica live marathon series, Boger Synoptic. Okay, so today, new time, a change in schedule because our very dear friend Dr Jitesh Sharma had some other commitments, and I very desperately wanted him to be in this session because S is one alphabet, inaudible. Am I audible now? आवाज आ रही है? Just confirm somebody. आवाज आ रही हो या नहीं आ रही हो तो बोलिए नहीं आ रही है. आवाज आ रही है आप लोग को? Audible. Okay. Yes, sir. Nigam, Jigar, Gori. Okay. So new time because our Jitesh Bhai had some prior commitments, and I desperately wanted him to be in this session. And after a long time, I also said मुझे भी मेरा Saturday night लगना चाहिए. थोड़ा सा कुछ आराम मिलना चाहिए because Saturday night I have been keeping you all busy and I myself am busy. So I just thought of doing it in the afternoon, and we are going to soon have Jitesh Bhai with us. Jitesh Bhai, S alphabet के लिए specially आपको हम लोगों ने
chase very easily.
Good evening, good afternoon.
Good afternoon. कैसे?
बस बढ़िया. Am I audible? Is my voice is clear?
मुझे तो क्लियर है, बाकी सबको.
अच्छा, आपका आवाज थोड़ा क्रैक आ रहा है.
अच्छा, सही हो जाएगा.
अच्छा,
अब आ रहा है ठीक से?
It is good, but it is like cracking. बहुत cracking है उसमें वॉइस में.
अच्छा,
अभी ठीक हुआ?
अब ठीक हो रहा है?
हाँ, अब ठीक हो गया.
Okay.
Is my voice is clear now?
Absolutely, your voice is clear and your thoughts are clear and your face is clear. Everything is clear. Jitesh bhai, welcome once again. पिछले वाला session 8,000 views, क्या बात है. तो I'm very happy. एक 8,000 views आपका है and दूसरा एक 9,000 views पे हम चल रहे हैं. डॉक्टर जिनका कल बर्थडे था, क्या बात है. मतलब हम लोग का जो पूरा सीरीज है वो आप लोगों
मेरा कल है.
आपका कल है? अरे क्या बात है. जिसके बर्थडे आ रहे हैं उनके व्यूज भी बढ़ते जा रहे हैं. क्या बात है. तो आप लोग का बर्थडे लगता है ये लोग ना ये वीडियो देख के मना रहे हैं. ये सोच रहे हैं कि चलो हम सर को देख लेंगे, हम सर मैम को देख लेंगे तो हम और उनको सीख लेंगे. तो अच्छा डेडिकेशन दे रहे हैं स्टूडेंट्स आप लोग को. स्कॉर्पियंस वी आर.
बस तो लेट अस स्टार्ट टुडे.
यस. हम शुरू करेंगे सारसा परिला से. हमने ये लास्ट टाइम सारसा परिला तक किया था एंड आज हमको स्कोपारियस से शुरू करना है.
ओके, सो प्लीज यू स्टार्ट.
नहीं, ओपनिंग तो आपको पता है, आप ही को करना है. स्कोपारियस,
स्कॉच ब्रूम, स्पार्टियम, स्कोपारियम एंड स्कोपारियस, ये सब एक है. एंड आई थिंक स्पार्टियम, स्कोपारियस एंड सार्थोमनस स्कोपारियस भी एक अलग नाम है इनका.
हाँ, सैरोथेमनस.
इसमें बच्चे काफी कंफ्यूज होंगे.
हाँ,
बट अब स्वाबे बनाता है इसको सिस्टेरियस स्कोपारियस सिस्टेरियस ऐसे करके नाम दिया उसने.
स्पार्टियम स्कोपारियम.
ये सेंट जॉर्ज बनाता है. फिर एक आ गया ये सिस्टस स्कोपारियस करके बनाता है स्वाबे.
ओके.
तो इसमें कंफ्यूजन काफी रहता है, तो ये मैं क्लियर कर दूं पहले.
ओके.
और मेनली एज माय जैसे एक्सपीरियंस है इसमें, जैसे बहुत सारा heaviness, बहुत सारा heaviness in the bowels plus hypertension, and जैसे GI plus hypertension, I would have thought of Spartium, scoparium. Basically, in nephritis cases where hypertension is not getting controlled, so and this typically has this lot of foamy urine. So in urine में albumin भी काफी जाएगा. Albuminuria is very marked due to hypertension. So you can think of remedy when you're struggling, and even in chronic nephritis cases where plus high BP and BP is not coming down in spite of taking hypertensive drugs. So you can definitely give a thought of this Spartium, scoparium. It does help wonderfully, and I have used in 30 potency. So I have got results in 30 potency, and Abhishek bhai has also given me a lot of help in this. Let me tell you. So Abhishek bhai knows much better. Please give some inputs.
नहीं यही कि फर्स्ट थिंग कि ये पूरा कंफ्यूजन निकाल दिया आपने कि स्कोपारियस, स्पार्टियम, स्कोपारियम, स्पार्टिनियम, सिस्टस, ये सारे एक रेमेडी हैं. इट्स अ वाइल्ड ब्रूम वाली रेमेडी है, बेसिकली यूज्ड फॉर ब्लड प्रेशर स्पेशली व्हेन देयर इज हाई प्री रीनल लोड. जहाँ प्री रीनल लोड ज्यादा होगा, जहाँ पे रीनल ब्लड प्रेशर ज्यादा, रीनल डॉपलर में प्रेशर ज्यादा आ रहा है, and that hypertension which may affect kidneys in that case where you rightly pointed out, जहाँ albuminuria, because आपका EGFR affect होगा तो आपका albuminuria आ जाएगा. तो उस टाइप पे आप किडनी डैमेज हो, ब्लड प्रेशर हो, albuminuria हो, ये सब चीजों में स्पार्टियम, स्कोपेरियम आपने बहुत, you rightly pointed out the potency. I am using 3x potency which is very effectively giving results. Similarly, using it in 30 and other low potencies of LM scale should be also
even
beneficial.
Working good.
Yeah. So these should be the right indications. Next is why Scutellaria.
Please, sir.
Scutellaria, I'll just say, इसमें तो definitely ज़्यादा कुछ लिखा हुआ नहीं है. Neurotic, sleepless, neurotic women लिखा है and sleepless for nervous excitement. So definitely confirm नहीं है मेरे practice में especially. But what Scutellaria, what I know, Scutellaria is also, again, Scutellaria का भी एक बहुत बड़ा confusion है. It is also called as cola. बोरिक में इसको कोला के नाम से लिखा गया है. तो कोला is a very good remedy in low potencies as a tonic where cancer patient is landing into cachexia, emaciation, is losing weight extensively. So this remedy you can use for the patient जो weight loss हो रहा है, emaciation हो रहा है, उसको prevent करना है, patient का weight gain करवाना है. जैसे हम लोग ट्यूबरक्लोसिस में हाइड्रास्टिस मदर टिंचर के बारे में सोचते हैं, वैसे इसके बारे में सोचना चाहिए, इसके मदर टिंचर, इसके लो पोटेंसीज के बारे में सोचना चाहिए when we have to think, when we have to give for cancer cachexia. Okay, so it's a tonic for cancer cachexia.
Can I add something?
Yes, please.
Scutellaria used in low form, especially in trigeminal neuralgia as an pain reliever. हेलो
या सॉरी, अभी आज दोपहर का टाइम है ना, तो कॉल्स थोड़े बीच बीच में आते रहेंगे, तो वो मेरा एक ही फोन है तो इसी पे कट करता रहूंगा, तो बीच में 10 सेकंड का लैग आ जाएगा.
अच्छा, तो Scutellaria is one of the remedy used for trigeminal neuralgia in low form. Actually, it helps arrest the pain immediately, especially in low form in 3x, 1x, 2x. In low form, Scutellaria has given great results in arresting the pain of trigeminal neuralgia.
Great.
It has been,
ये तो मुझे भी नहीं पता.
It has been written by this book. In this, yes, I have already shared that.
Okay.
So coming up the next fecal core.
Yes.
Fecal core, अब क्या बताना है इस दवाई के बारे में तो सभी जानते हैं. This actually acts on more of a circulation level where there is dead or ischemia, basically coldness, blueness, and the boils have, I think, green pus. Yes, has been written here. The boils with green pus, and very interestingly, fecal core is a remedy where the sweat actually destroy their shoes. It's very unique. The sweat, your shoes will get destroyed due to the sweat, the foul sweat. So that you can say it is very, very acrid in nature, the sweat, and there is a lot of coldness in the body. in cecal core. And cecal core loves cold bathing in spite of the coldness of the body. That is the thing here. And cecal core is an excellent remedy for retained placenta. Actually, we said when there is a when you find a case which is an incomplete abortion case where there is a placenta is retained, you can use cecal core in low potency. In a 1 week, my personal experience, in 1 week it will eliminate the fetus. The remnants, actually, the remnants. It's not clear and they are required to do a DNC. You can definitely give a shot with cecal core. It does help.
Okay.
And you would like to add, please?
So basically, I just want to add, because even I've used this remedy very wonderfully. I've had great success in few of the cases where you can prevent amputation and all these things. So basically, the idea behind this is that the remedy is very good when there is static or stasis of blood flow. When the blood flow is very much reduced, there is stasis of blood flow. In that case, where you want to increase the blood flow to an organ, Jitesh bhai, your network is fluctuating, Jitesh bhai.
No, I'm fine, I believe.
थोड़ा सा बीच में नेटवर्क जा रहा है.
नहीं, आपका ब्लर हो जा रहा है, फिर नॉर्मल हो जा रहा है.
अच्छा. ओके, तो शायद हम दोनों में से किसी एक का नेटवर्क का आज प्रॉब्लम चल रहा है.
कोई नहीं, प्लीज कंटिन्यू.
So this static blood pressure, basically where there is a lot of stasis, where there is where the blood pressure is low, where the blood flow is low, where you want to establish high blood flow to the organs, to the arteries, to the veins, where you want that the blood flow should increase. And जब blood flow low हो जाता है, तो obviously जो distant organs हैं, distant organs पे ulceration शुरू हो जाएगा, तो definitely you will have non-healing ulcers, gangrenous ulcers, wet ulcers. So all these definitely will form as a good indication for cecal core. But the basic idea, the pathological idea behind that, it will definitely help in re-establishing and the blood flow of the vessels.
So it has been written there, foul and indolent ulcers.
Yes.
So which are non-healing ulcers. And add, if you find ulcers still not healing and you get a culture done and you find staphylococcinum, you can think of staphylococcus as an intermittent, and it will help heal the ulcer.
Perfect. Okay, bhai. Next is selenium. Selenium.
So you start.
Yeah, selenium is basically used for debility. So selenium में जो भी आएगा, basically you'll see these. It's a micronutrient these days, where you will see it is being prescribed. Selenium is prescribed to a lot of old age patients also, where there is a lot of senility, debility, weakness, emaciation. So all these symptoms these are all the symptoms itself of selenium. Also, again, there is a lot of lasciviousness also, which is being highlighted. That lasciviousness with impotency, where there is in old age patients, in the patients who are who have a lot of debility, senility, who have forgetfulness, a lot of forgetfulness, and all these old age patients, usually the vital reactions also stop coming. So you'll see very frequent cold coughs coming up. You'll see morning time coryza, which is very frequent in them. So basically all these things have also been highlighted for selenium.
Yes, like the most important point, if you confirm selenium, if you ask them perspiration getting like the stiffen the linen has been, that's the typical of selenium confirmatory point.
Yes.
And selenium is like obvious but important. And especially selenium is for like premature salinity plus hair fall, potency plus debility. That completes the selenium.
Yes. Okay. So that's about selenium. So next is by senecio.
Senecio is a wonderful remedy where patient will come and tell you that I feel like I'll have the menses, but I have so much of back pain. I feel like the mens would appear, but it doesn't appear. Also in functional amenorrhea. And senecio is a excellent remedy for sleeplessness in sleeplessness plus amenorrhea. So now there is a correction. I'll have to correct. In my book, in this Boger book of this yellow one, there is written sleeplessness with anemia. It is wrong. It is wrong because in Senecio, the original context, it is written sleeplessness with anemia. So that means amenorrhea, not anemia. Let me correct. Don't get confused because there might be some error in printing mistakes. But let me correct. So you don't get. This is very important in sleeplessness because you have very few remedies with sleeplessness with amenorrhea, and this especially Senecio aureus is mainly in more of disturbed basically organs where there is a cases of functional amenorrhea cases. You can think of this, and there is also dysmenorrhea, and the pain actually in Senecio comes from ovaries. It radiates to the breast. So patient will come that my pain is going from down to upwards. That way you can think. Plus there will be a lot of disturbed irregular menses. So you can definitely think of Senecio. Plus the backache. Backache is very, very typical because they feel that their lumbar would break. So this is very typical of Senecio.
Okay.
Anything you would like to add?
Yeah, so just for Senecio, that it is a remedy where everywhere there is a functional disturbance, where there is functional dysmenorrhea, where there is functional amenorrhea. So where the vital reactions are lacking. Basically, it's the first line which is mentioned in the Boger is very important, where the lack of vital reactions. So lack of vital reactions at any level, you might generalize it like the way they used to. It's done in the Boger Bonegushan repertory where there is absolute lack of vital reaction at any level. You can think of this remedy of Senecio, which the other points like whatever Jitesh Bhai has mentioned, that everywhere you go, see, everywhere there is brittle nails. Now, brittle nails is again the basic nutritive value of the body is increasing, and it gives the weakness of your nails also. So it's just like Silicea, but Senecio is more related to the genitourinary organs.
And especially the nausea, especially of renal origin or vomit renal origin, also you can think of Senecio if tabacum is failing somewhat.
Yeah. Okay. So next is why Senega. So Senega is again, Senega is moreover highlighted to the ENT and the chest. ENT and the chest. This part, where there is subacute catarrh.
Yes.
Yeah. भाई
And
आपका थोड़ा सा लोकेशन चेंज कर सकते हो क्या? नेटवर्क का बहुत या थोड़ा सा आप कहीं पे मूव कर दीजिए तो
your video is lagging. My is perfect.
हाँ अभी एकदम परफेक्ट हो गया.
अच्छा अभी ठीक हो गया. ओके.
हाँ ओके ठीक है. तो ये सेनेगा बेसिकली फॉर acute, subacute, catarrhal conditions of ear, nose, throat, and chest. So where there is excessive burning in the air passages, what is more highlighted, there is loose rattling in the chest where the cough brings up very easily, but has to be profuse, has to be clear expectoration. And every time the patient bronchs, it is not difficult. There are a lot of remedies where there is difficult expectoration. There it's more of easy, loose, rattling cough with easy expectorations. And there is a lot of soreness in the chest where there are different spots, maybe circumscribed spots what patient may show up. But there is a specific point which was highlighted by our previous speakers, that these sore spots are aggravated by touch or in open air.
True. Because it is more of related like a causticum like expectoration, but causticum cannot hawk it up. That's the difference. And in this the actually the cough ends in sneezing. What I remember of Senega very profound. Yes. That is actually very peculiar of that. Cough ends in sneezing. Yes, to be next.
Next is sepia.
Sepia, the draggy, relaxed females. Sepia, what to say about sepia is such a big remedy.
Yeah.
Sepia, washerwoman's remedy. Sepia, there is a lot of choking which arises from the stomach actually. It is very important to understand. There is the choking which arises from the stomach. Only 2 remedies are there. I remember very beautifully this Dr. Dorothy Shepherd has has mentioned very peculiarly that mancinella and sepia are the 2 remedies where they have a typical choking sensation which arises from the stomach and it goes up to the throat. And sepia, the indifference you speak about, and they just don't want to, and they have the lot of tension of domestic affairs, and they are very sad about the domestic affairs. Things opposed to intentions. They don't want to do it, yet they have to do it. So that is the botheration of sepia. All the complaints and the dispute, the husband, the mother-in-law, the father-in-law, everything comes where, and they are better when they are occupied. That is occupation amelioration. And the typical saddle-like appearance, the another remedy has it, that is menispermum. Menispermum has that. Plus the dark eye, the sepia dark eye, worn out woman, we can say that is also sepia, worn out. And along with this, the sepia backache. The sepia backache always get relieved once they put the pillow at the back. I remember very clearly, because if they'll say that I'll put a pillow in the back and I sit, my pain goes away. That is typical sepia. And the sepia is marked when you see the coldness of the hands and feet. The coldness. Coldness when you check, you see there is even the feet are always cold. And I remember people, the women or girls who typically wear socks very early before winters. That also depicts that, okay, they are so cold. They are so cold, could be fall in the category of sepia. And the habitual abortion. Plus, what I remember very beautifully is for retroflex uterus and retroversion of uterus. Sepia and ileum tea has never failed. And I know many people know about many things about sepia and what to think about this. Diarrhea from boiled milk has actually blown out, which I read from Dr. Phatak's case, and I have tried in IBS also now, because this boiled milk aggravates. As soon as he, on the wedding of the first night, he drank boiled milk, and then he had that loose motions and he got well by sepia. That was typically a beautiful case by Dr. S.R. Phatak, which I read in his clinical experience of book. The diarrhea, especially the boiled milk diarrhea. It's a very beautiful, and sepia acts very good in this because they get aggravated by boiled milk.
Okay. Perfect.
And yes, the constipation. So many people we see, because of the sepia action on the pelvic congestion, it contains all the symptoms what pelvic has, from back pain, from sacral pain, from they have constipation, the swelling in the labia, the pelvic congestion, pain which radiates to the legs, the pain, the sciatic pains radiates to the leg, more of downwards, you can think of sepia. But as soon as they work, they don't have any pain about it. So you will confuse with Rustic, Sepia and Valeriana. Rustic, Sepia and Valeriana, they all are better by motion, but as soon as they sit, everything aggravates. And more of sepia has more of the flexures, the eruption in the flexures. And if you give the best potency and still the fever is not, the changing of potency and still the fever is not getting down, the sepia is, if I remember, the sepia is the drug. That's why it's written irregular fevers. Fevers of changing paroxysms. And fever which has the paroxysm continuously changing, that's what sepia is. That also depicts the indifference in fever, the changing paroxysm.
Okay.
So you can add, sir, because it's such a big remedy.
It is a very big remedy. Basically, people have taught this for days and days. So the time will always be insufficient. I just want to highlight 2 things. One is that there is a lot of laxity. Basically, there is a lot of laxity at every level. Now, this emotional level, physical level, everywhere. And like what you rightly said, they will do something which they actually don't want to do. This in the Lycopodium also I had males. When this happens with males, when they don't want to do something and they have to go against their will, and the males have to do something, it's Lycopodium. And similarly, in females, at every juncture, at every change of life, may it be menarche, may it be marriage, may it be menopause, may it be bearing a child, may it be parturition, all these different stages of life where there's change in life situation for women, it is always aggravation. In a sepia female, it is always an aggravation. At every level, you will see that these people will aggravate. There is lactation, like the suicidal tendency and wants to kill the child, and all these things. Postpartum, you'll see postpartum depression. All these things we have seen always very highlighted. But the basic nature, the basic genius, which always Boger says that we should hold on to, the basic change you should always, the primary secondary reaction, initially it will be too laxity, and to too laxity will go into immediately then into an excessive stiffness. What you said is correct. That patient initially is in too much of diarrhea, then in the later stage will end up into constipation. So you'll see bilateral, both the polarities in sepia and rest, everything what you have highlighted, and then we can go on for sepia, and then there is no add. You wanted to add something?
Yes, I want to add only one last thing before ending sepia. Sepia is a remedy where you doesn't find heartbeat in the child, and when you give in hypotency, it does help. And I have experienced also, and plus Dr. Kopika sir has mentioned in his book.
Yes, it has been. Okay, bye. So let's go to the next remedy, and that is Silicea. Silica. So silica, again, the senility, you should not remember senility. There is a deficient nutrition, basically. That there is deficient nutrition is the basic genius of this remedy, where you'll see that the deficiency of nutrition from since birth, you might say that is intrauterine. The mother of the child could have had all the deficiencies of nutrition for all the reasons, and then it comes to at every level for the mind, body, and then you can see that brittle nails again coming up. There is excessive lean, thin, emaciated people, dark complexion. They've really never developed. Intellectually, they might be very good, but physically, they are inefficient to accomplish any task. And large head. So this is about sepia. Again, the pot belly. We have differentiated a lot of time with marasmus and all these clinical conditions. You have excellent results coming up in tubercular adenitis, lymphadenitis. So, and not to forget, it comes with excessive perspiration, with hands and palms, and which is offensive to smell. Over to you.
So more to add about Silicea is the rigidity, very stubbornness. Silicea has they are very stubborn people. They are, no matter what they want to. That's why they are very much ambitious also. Silicea people, and they have a lot of rigidity, and more of the skin eruptions are very much obstinate as well as, and this coryza, even the closure of the Eustachian tube in the coryza with discharge, you can think of chronic discharge. That's why in earache, in otitis media, Kali Sulf, Silicea, Pulsatilla, these are the top remedies you can think, because they have a sphere of action typically, and majorly fissure in anus also, plus fistula, plus nodes on the mammae also, where there is growth, like Abhishek Bhai told that tubercular adenitis, the growths, the tumor-like appearance, which is not at all going away. But let me add one point. Any patient who has stent in their heart, never ever give Silicea.
Because foreign body expulsion.
Correct. It will expel the foreign body.
Okay,
so newcomers, please make a note of it.
Yes. हार्ट के स्टेंट में मत देना, और बहुत बार यहाँ पे यूरेथ्रल स्टेंटिंग भी होता है, esophageal stenting भी होता है. So there are a lot of stentings that is involved. So always remember, Silicea का contraindication रहेगा. पेशेंट का अगर सीए इसोफेगस के पेशेंट में इसोफेजियल स्टेंट डाल के भेजा है, तुमने सिलीशिया दे दिया, तीसरे चौथे दिन उसका स्टेंट बह जाएगा और वो आ जाएगा वापस डिस्फेजिया के साथ.
You know, was Silicea big belly people.
Yes.
With thin legs.
Thin legs.
So next, Solidago. What to say
Yes.
about Solidago? Solidago is most used remedy in nephritis cases where there is no urine output and they need catheter, but the urine can come out only by catheter. So that's where you have to think of Solidago. It acts on that level, especially when there is a history of recurrent cystitis and backache. They'll have backache typically, and even in diabetic eczema, where there is a history of gonorrhea, you can think of Solidago. So that again implies the cystitis only, due to which renal complaints triggered. So you will find a lot of patients who have a history of UTI, and then they have complaints of retention of urine, and for that they have to use a catheter so that the urine will come out. So it is actually known as Solidago is known as a homeopathic catheter, and it is actually increase the frequency of urination as well as it is act as a diuretic also. So make sure you use wisely of Solidago. Because it has clearly all the kidney dysfunctions and they are very, very weak and catch cold tendency. That's what Solidago, along with uremic asthma. So Solidago one is very much neglected and many people don't know about it. Due to high urea, the asthma symptoms get triggered in patients. You can also think of Solidago because it will help. What is urea? Urea is like the waste product of the kidney. So because of that, the asthma symptoms get triggered very high. So you can think of Solidago in this case of uremic asthma. And the potency you want to know about Solidago, I have used in 3x.
3x.
Yes. Okay. And also.
So somebody just, sorry, I'm interrupting and going back. Somebody, Raj Gupta pointed out a very good thing. We both were nice. We just had a joke. Silicea nahi dena chahiye. So wo, in the cases where there is foreign bodies like stenting, तो क्या करना चाहिए? He's asking what he has asked is, तो फिर ऐसे cases में क्या करें sir? Silicea दें कि नहीं दें? Because नहीं देंगे तो भी problem है, देंगे तो भी problem है. तो ऐसे cases में what do we do then?
So actually, you have when Silicea is contraindicated. First of all, you cannot give Silicea. So you have to see most similar symptoms which is closely associated with this. Totality, but not Silicea. When you know that Silicea is fatal, why to prescribe a remedy which can actually expel and worsen in condition?
Worsen in the condition.
You are responsible for that.
Okay. So just one thing about Solidago, Jitesh bhai, I'll add, because that this basically all the conditions, cystitis, nephritis, or everything that you absolutely said is, I'll agree, prostatitis, everything. But basically, again, everything is starting from deficiency. It is kidney dysfunction. There is the decreased renal blood flow. Decreased renal blood flow will lead to several pathological changes. So all these diseases which might come, all the symptoms that might come up, if you want to, very again important point that you highlighted, because it is increased urea. Where there is increased urea, it is increased creatinine. There is kidney dysfunction, which is at the very preliminary stage, where the creatinine is still in the range of below 4. It's a very ideal time to use, add Solidago to your prescription, because that is the time where you can actually help in reversing pathology. But the patient has not yet been dependent on hemodialysis. So before the stage where the patient can actually, if there is any scope to do something with homeopathy, I think Solidago will play a very vital role.
And to add, if somebody's urea is not getting controlled, there is a medicine called urea purea. So it actually helps if you speak about urea. So your Spigelia.
Next is Spigelia. So Spigelia, again, very important line. First, heart and eye and heart. Everything will go hand in hand. There is severe. We all know neuralgic complaints, which is where there is nerves are involved of facial. Very importantly, this trifacial, heart and eye. So basically, facial neuralgia, trigeminal neuralgia, where there is excessive pain of neuralgic origin, and very well written and very well confirmed by, I think, all of us who are there in this, who are going to see this, who are seeing right now, it is left-sided. The left-sided complaint are again very well marked. And again, there is excessive when it comes to heart. There will be increased the tachycardia will lead to excessive palpitations, and when it is in the eye, it will lead to the throbbing pain. So this is how it is.
So Spigelia is a remedy, especially more of nerve, and I would call, if somebody doesn't believe in homeopathy, if he has a headache, you give Spigelia 200, it acts much better than Neprosin 500. So Spigelia is something brilliant medicine what we have. And especially if somebody is complaining of arm pain, especially left-sided, and has stinging and stabbing pains, please think of Spigelia immediately. Whether comes false, still he doesn't find any findings, still he complains of pain. I have relieved many patients like this. Spigelia has actually come to the rescue. And let me share another point. What Spigelia has, the typical children who comes with a pain in the navel, and they have a history of worms. You can definitely think Spigelia also in that cases.
History of worms.
Yes, history of worms. And the eye, the bulging of eye, the congestion, and they have a lot of pain in the eyeball socket. They keep on complaining, especially on the left eye. So you can definitely think of Spigelia. And where they are worse by tobacco. The most point here is they are always worse by tobacco. So you can definitely think of Spigelia in those conditions. And they have typical in patella, they will complain of typical pulsation. That is very unique what makes in Spigelia, because everything is throbbing. The headache is throbbing. Again, grand generalize you this throbbing everywhere.
Yeah.
So then automatically it comes Spigelia.
Next is why Spongia.
Spongia is a remedy I have recently used in a thyroid cancer.
Okay.
And it has been responding very good. The patient was not able to eat, and definitely why? Because there was a lot of suffocation. What is unique about Spongia is a lot of suffocation in the throat, and there is lot of pain and choking generally. And now many people will think of choking. This is choking related to thyroid, not to heart complaints.
Thyroid compression.
In heart complaints choking, you think of Naja.
Yeah.
So again, they have tickle. We know that that irritating cough of Spongia, dry hoarseness cough, typically like crowing and sawing cough. That typical makes of Spongia. It's typically aconite, hypersulfan, Spongia, like Hahnemann has used it in acute croup. In croup, typically croup coughs. These three are the top remedies where aconite and hypersulf doesn't give much results. Spongia comes to the rescue always. So if somebody has a thyroid complaint plus cough, especially dry cough, recurrent, you can think of Spongia. And typically we call it barking cough. If they cough somewhere else also, the noise is so nagging and so harassing, you can typically find that that this is Spongia. But let me tell you, Spongia is one of the most important remedy, you can say, where the testis, I have used testis, there is the swelling, and it becomes very, very hard, very hard testis. When you examine, when you touch, the testis becomes very hard like stone. Now you will confuse with calcarea floor, but no, Spongia comes to the rescue in that. So these all things are very important, especially the irregular palpitation due to thyroid complaints also against comes Spongia. And Spongia, the cough aggravates by sweet. Rightly said by Dr. Kadambari, the cough which aggravates by sweet. So a lot of children eating sweets and getting cough. So you can think of Spongia this way, because the child is get harassed due to cough and they actually cannot sleep. That's what more of, they also complain with burning in the chest. So you need to add something.
Absolutely, you have covered up almost everything. It has a wonderful action on because it has a wonderful action on glandular tissue, thyroid gland and testes. Both glands will be induration of both the glands. It gives wonderful results. Again, you said very highlighted that it's a syphilitic remedy. It will give wonderful results in cancer-like symptoms and goiter, and in heart and in lungs. where the basic tissue, where the simplest most of the tissue, there is excessive accumulation of mucus, which leads to chest oppression or the heart oppression, or the laryngeal, the larynx or the alveoli. There is excessive the basal cells get a lot of accumulation of mucus, which ultimately leads to laryngeal crowy cough. And it is, I guess, it is a very, very wonderful remedy where everybody has added a lot of modalities: drinking, eating better by drinking, aggravation, talking. So all these are very important things, and I think we all together, the Spongia, we have all summed up very well.
So Spongia cuff is always better by lying the head low, not like lying the head up. So that is marked. Spongia is another remedy for valvular lesion, where the valves are getting affected, and due to this they get cardiac coughs. So again, Spongia. So that way you need to understand Spongia. So next is
Squilla. So Squilla, a wonderful remedy for it. Again, there is a very deeper level of understanding given of mucus, serous, kidney, heart, spleen, but obviously not used very much for that. You can highlight if you have seen any on the practice. What I have seen is more of the ENT complaints, where there is rattling cough with sneezing. There is excessive sneezing. The sneezing is a marked symptom with cough. There is flowy nose. There is excessive sneezing, and where there is also, just like causticum, where you might see that patients tend to have involuntary urination or some spurts of urine coming out with cough and sneeze. So that's about my experience, and over to you.
It's rightly you said very well. It is more of involuntary urination, involuntary spurting during cough. The only things which separates that is causticum is a chilly patient and Squilla is a hot patient.
Yeah.
Thermally, and Squilla has more of what I have used in the dropsy. In the dropsy, and where they have a lot of dropsy and they have profuse urination. Like due to dropsy, they have involuntary urination also. And they the main thing is Squilla. In the chest, they feel like something needle-like pinching in the chest while they're coughing continuously, and they are very hot patients, so they like cold things a lot. So and which aggravates actually, especially the asthma, So in that way, I have used Squilla, and this is very, very important remedy, especially when you compare to the involuntary urination where the causticum fail. You can definitely think of Squilla. It does rescue it.
Okay. Dr. Drupad is saying shopper's heel pain is Squilla. Okay. Thank you, Dr. Drupad.
Thank you. The next
is Stannum.
Stannum met what to say. It's complementary to pulsatilla, is more like of picture. The Stannum people are like holding the chest while coughing all the time, and they are very much irritated due to cough. So, and they get repeated short attacks. As well written, Boger has written extreme weakness. Yes, these patients will reach to you in your cabins and they'll be extremely fatigued due to cough. So much fatigue, they cannot even speak. They cannot even walk. This exhaustion typically duplicates of Stannum. When I see patient who has harassing cough, which is not at all going away, and they're very debilitated, their energy levels, you can see that he's very, very dull now, sunken eyes, and is coughing since long. And suppose he had a history of TB also in the family, definitely Stannum would have come first choice, because even in abdominal pains also, Stannum met has this typical modalities. The pain increase gradually and then slowly subside. So pain comes gradually, goes gradually. That's what the unique of Stannum also. The taste, the salty expectoration, that is what makes of Stannum very peculiar. Especially, and they even complains that something is not there in the chest. मेरा chest पूरा खाली हो गया doctor साहब, पूरा खाली लगता है बीच में. So this typical line has always confirmed me prescribing Stannum med, that he doesn't feel.
Another just sorry interrupting you. Another very confirmation का बात कर रहे हो ना, इसलिए मैं बोल रहा हूँ. ये confirmation, एक तो weakness है, दूसरा voice is absolutely gone with the cough.
Yes,
absolute. एंड इसके लिए भी अगेन आई गो बैक टू माय फेवरेट बुक, कोपिकर सर के बुक में जो एग्जांपल लिखा है, कोपिकर सर के बुक में एनएम चौधरी सर का एग्जांपल लिखा है कि उनके चेयर पे आके पेशेंट ऐसा थप करके बैठ गया एंड दैट टिपिकल, एंड ही सेड बैठने पे ही उन्होंने बोलता है बताओ क्या सर कि क्या अभी तो बोलने तो दो सिम्टम, नहीं नहीं बैठने पे ही बता दो कि क्या देना है। देन ही सेड कि बैठने पे कैसे बता दूं कि क्या है, एंड ही सेड बैठने से ही पता चल गया। ही सेड ऐसा फुल फोर्स के साथ पेशेंट ने पूरा बॉडी छोड़ दिया जब चेयर पे बैठ रही थी एंड वॉइस नहीं आ रहा है, खत्म। So these are classical symptoms of sternum metallicum. Rest whatever you have seen. Sorry, please continue.
Sternum met has one typical feature which neglected most of the time, that is burning of palms and soles. It is very peculiar to sternum because we all know sulfur medorenum very well, but you neglect sternum and also sanicula.
Okay. Great. So भाई that is about sternum. मैं तो कुछ इसमें ज्यादा ऐड नहीं, मैंने बस वो कोपिकर सर वाला ही हाईलाइट करना था. And next is then Staphysagria. Again a very very big remedy. Staphysagria is again a huge remedy like Sepia. We can go on and talk about Staphysagria, but what we have to remember is the first line obviously of the Boger and a very important line written in Allen's keynote. Nervous trembling is very important. Patient has sometimes in the past, patient has undergone that kind of an insult, that kind of a situation where the patient he comes back in that shivering state, then the pathological changes will start. You should always remember about Staphysagria. And yes, Dr. Kadambari is writing honeymoon cystitis, ailments from rage, insult, indignation, reserve, displeasure. Yes, Dr. Kadambari, you're right. And rest, we have symptoms of blepharitis, we have symptoms of recurrent styes, chalazion, and then we go and then there is very important this style, something very important like styes, this Heberden nodules which we see in advanced cases of arthritis, which is very painful to touch, and post-operative wounds, which we all use it, post-operative wounds where there is it is used very important where there is splinter-like pains. Okay, so this is about Staphysagria.
So Staphysagria is a remedy where any insult to the organ, any insult, you go to endoscopy, it triggers the complaint.
Yeah.
You go to a
Yeah.
endoscopy, complaints get triggered. So any insult to organ or mind or any body, any insult, mental or physical insult equal to Staphysagria. Simple. And Staphysagria has what we said. He is too dignified to fight. Simple. It ends here. So next,
Yes.
Sticta P is a typical remedy where the patient comes and tells that I have excessive dryness, I need to blow. I try to constant blow, but nothing's come out from my nose. This where Sticta has actually helped. And next, Sticta has actually helped in bursitis cases, especially housemaid knees, where they wash the floor, they clean the floor by like old maids used to do. Nowadays, everyone mops. But the old maids who actually clean the floors with their hands, they have to bend their knees and work. So typically they complain of bursitis and the rheumatic pains in the knees. You can definitely think of Sticta P. And typically for sinusitis and rheumatism, that is bursitis, you can definitely think of Sticta P because they have very much sphere of action in their mucous membrane. A lot actually in Sticta membrane, and they all the complaint and the pressure they complain here, the root of the nose, which yet differentiates when you try to press this root of the nose, the pain gets emulated in sinus, that is kali bichrome. But here they don't get relief. That's what makes Sticta. And let me tell you, for frozen shoulder on the right side rheumatism, you can again think of Sticta P.
Okay.
Next.
Perfect. Next is by Stramonium. Stramonium again a remedy, like rightly mentioned. The first line is very important. The remedy of terrors and but lacking in pain. The wherever, just like opium, where there is pain is expected, where there is pain is expected in certain diseases, it is absent. And terror, the terror word is so huge, such a deep word here, that terror, the patient himself is a terror to the doctor. Whenever he comes to the clinic, in the waiting room itself, the kind of energy, the kind of terror, the kind of uh, energy that he carries, it is so violent that I think there itself you can make a prescription of Stramonium. It is very frequent these days with uh, cases of ADHD, where we can see left AV, and yes, once is very highlighted that Stramonium is a very good remedy for AVN also. And there is Stramonium has a lot of mania included, just like Hyoscyamus, Hydrophobium, Lysinum, all these cases where there is excessive, and it comes with a lot of night terrors like belladonna, where there is fear of darkness involved. Again, patient wakes up with this fear in the night because he has this night terror, and when he wakes up in the night and if he finds that the lights are switched off, he might get that terror attacks once again. So multiple levels Stramonium can be used. आप बताइए जितेश भाई.
You have concluded, and Stramonium is such a big remedy.
Yeah.
We cannot conclude in certain. All the terror and the darkness of fear of dark and everything black things, or everything black cat and everything black.
Yeah.
It doesn't like black cat. So these all fears are more of Stramonium. Along with that is more of very much religious, and insanity level is very high, and typically Bella, Hyos, Stram, and Verat.
Yeah.
These 4 remedies for all the type of insanities.
Yes.
Next
is Spongia carb.
Spongia carb, what to say, he has never failed actually. In my father's case also, he got sprained in Banaras Ghats. He went down and he got sprained, and he had got such a big swelling, and we used Strontium carb, and within like 24 hours his all swelling went off. And Strontium carb is for ankle edema, typically due to fracture. You can think of Sticta. Especially, I missed a point. Operations after he gets sleeplessness also Sticta.
Yeah.
Sticta P. And in edema after fractures, Bovista. Edema after fractures is Bovista, and edema due to sprain is Strontium carb. So if there is puffed ankles, it doesn't need sprained and puffed ankles.
Yes.
And even the surgical shocks, I would consider Strontium carb is more of like calcarea carb in nature, where calcarea carb is failing and they have typical like of more of fleeting pains here and there, extremely worse by cold. I would have definitely think of giving of Strontium carb rather calcarea carb, because they have share a same relationship like calcarea. And typically even the edema, more of rheumatism with edema, it falls under category of Strontium carb, where calcarea carbs fail also, because they have so much of edema, they cannot move the part. There is immobility of the part.
Yes.
So that's what I want to share. You can add, please.
Yes. Just again, very same chronic strains ka hai, so we'll go to the next remedy, that is Strophanthus hispidus. Strophanthus hispidus, a wonderful cardiac remedy, can be used for mitral regurgitation, where there is where you can see the hypertrophy at the base of the heart, the apex of the heart. You might feel you might auscultate the beat to be much stronger than the rest of the area. And dropsical condition in cardiac, generalized dropsical condition which arises from the cardiac origin. I think that is about Strophanthus hispidus.
Yes, Strophanthus is like previous version of Adnan Sami. Those people are all like that's what Strophanthus look like.
Yes.
So
yes.
definitely think of those people who have a high BP and a heart history. You can definitely. Dr. Kadambaria said that corpulent constitution is Strophanthus.
अच्छा, she is highlighting अनंत अंबानी. आप अभी पुराना अगर किसी को याद नहीं है कि अदनान सामी कहता था, उसका आज का अनंत अंबानी देख लो.
Next comes sulfur. Sulfur is very big. What to sulfur is like originate due to scone. तू बहुत छोटा आदमी है, तू कुछ नहीं कर सकता जीवन में. They suffer through this phase of life, and then they try to be a very good person, a rat philosopher. They want to express, they want to show off, they want to show the world that I am something. This is all typical sulfur attitude, and they are very unhealthy. The skin is unhealthy. They love cold bathing. They have soul burning. They sleep with their feet out in the blanket, and especially anti-psoric remedy, the biggest king of anti-psora, that is sulfur. And sulfur, actually, as Hahnemann has told, whenever you give any remedy, until unless is given anti-psoric, the case is not going to be cured. And that's where sulfur comes at the top to think about when you struggle with any case. In my case, especially in cons, when I was struggling, I gave antimcrude and then I gave sulfur. The case got cleared up because I was struggling with antimcrude, it was not responding. So I am sharing my experience. And regarding the sulfur, what to say? Sulfur is the typical, you will find everything red, the red orifice, everything red, the lips red, the anus red, everything red. All the orifices are red, which is very marked in sulfur. And the 11 a.m. hungry and the 11 a.m. aggravation, the night hunger, the aggravation, the craving of sweets, you can find of sulfur. Along with this, in even chronic migraines, when you struggle, give sulfur 1 m or 10 m. In high potency, give 1 or 2 dose. Definitely, it will help in where we are struggling, because everything comes from sulfur. Like when you repertorize each and every case, sulfur comes up. This is the same story. When you struggle with all cases, sulfur comes to the rescue. This way it is. So this way you could use, and because sulfur is the biggest polycrest, I can say, it contains every complaint what a patient can has. So what to say more about it? Please, you can add some.
Just एक ही लाइन ऐड करूंगा. जो भी आपने बोला वो सही था कि वो पॉइंट प्रूव करना है उनको इंसल्ट के बाद ये वो, बट दे डू एवरीथिंग इन अ वेरी इंटेलेक्चुअल वे. ये जो उनका है ना कि वो कुछ भी ये नक्सोमी का नहीं है कि पैसा कमा लेगा, टॉप पोजीशन पे पहुंच जाएगा. प्लैटिना नहीं है कि हॉइटी टॉइटी दिखेगा, हाई सोसाइटी पार्टीज में दिया नहीं, कहीं पे भी कुछ भी नहीं आएगा. दिल writes, they'll get into research, they'll become authors, they'll become poets. जो भी है, it has to be intellectual. For sulfur, the most important thing is intellectual. उनको इंसल्ट भी वहीं से आएगा कि इंटेलेक्चुअली अगर उनको किसी ने गिरा दिया है, अगर उनका रिसर्च पेपर एक्सेप्ट नहीं हुआ है, या फिर उनका पीएचडी की वाइवा में उनका बहुत बुरी तरह से उनका इंसल्ट कर दिया है, they'll come out very brilliantly if that is a sulfur patient. So that is, I think that will be the conclusion. और कुछ ऐड करना है आपको सल्फर में?
नहीं, सल्फर करेंगे तो सेशन खत्म हो जाएगा.
So sulfuric acid, next is sulfuric acid. Again, acid है, sulfur है, बहुत very important remedy where there is sour mouth, hyperacidity, sour vomiting के लिए बहुत अच्छा remedy हो जाएगा. Again syphilitic background में अगर थोड़ा जाने जाएंगे तो patient को hiccups भी आएगा, bloody leukorrhea है, and again gangrenous condition where there is excessive bleeding and redness of the ulcers. Even
the teeth get sour due to
acidity.
And sulfuric acid mentioned, Hahnemann sir has mentioned in organ introduction where he used in gastritis cases where no remedy was responding.
Perfect.
So chronic cases where you're struggling, you can definitely think of sulfuric acid comes to the rescue, where they complain that the daant khatte ho jate hain, the sour. That's typical of.
And I guess yes, Janvi, you're right when you're saying chronic alcoholism. It's a very good remedy for chronic alcoholism, where I think it's mentioned in Herring's Materia Medica that if you add sulfuric acid to the alcohol of the patient, and if you give, then slowly and steadily the patient starts developing disinterest and distaste for the alcohol. आप म्यूट करके बात कर लो 2 मिनट, स्क्रीन पे म्यूट का बटन है.
Yes, I'm done. Actually, my battery is draining. I'm calling a charger.
No problem. And हमारा अभी होने ही वाला है. Sulfiode, I think next is sulfiode. Yes.
So sulfiode is a typical remedy which my experience started with lichen planosus cases where was stubborn chronicity of the complaints of lichen, where there is typical burning and so much of itching, like sulfur itching plus hot patient, extremely hot, like more than sulfur. And they like heat fumes are coming out from the skin. There's so much of hotness, actually helped me to think of sulfur iode in the cases, because they love to sit and sleep in the AC. That too, the temperature is like 16 temperature. They have so much of hot. So iodum and sulfur, most hottest remedy of the Materia Medica, when you combine, what happens? So that way sulfiode has been understood. They have lot of itching, typically so much of itching, they actually scratch all night, especially in the, like Dr. Vanch has written here, Baba's itch and tinea. This all things have actually helped. And there's a lot of suppuration also, because what happens, they scratch and it suppurates the skin by scratching after. And interestingly, they have all the burning internally. When you in externally, the part is cold. So that way it has been understood well. And more of complaints, the skin complaints are very much marked of sulfiode especially, and lot of itching, cracked necks. The crack, even in the purpose, is cracked. So even in lichen planosus, where there is cracks, deep cracks, you can think of sulfiode if the patient is hot. And they are extremely sensitive to anything. Even these patients come and tell that I apply coconut oil, still not relieving. What to do, sir? So this way I have understood sulfiode as chronic obstinate lichen planus eruptions or any chronic eczema which is not at all responding. You think of sulfiode where the patient keeps on highlighting that I am scratching a lot with the skin eruptions. You can think of this remedy.
Yes.
Next
is भाई सुम्ब्यूल. I guess sulfiode तो आपने बहुत अच्छे से बता दिया है. But yes. Sumbul again has a very limited area of action. But I would say it's more of related to heart, where there is end arteries of the heart are getting clogged. There is atherosclerotic changes. I think in low potency Sumbul will definitely help. And again, the atherosclerotic changes of the end arteries of the heart, if you have, then all the symptoms that are coming up will correlate to that. Where there is cardiac cough, there is cardiac asthma, there is cough aggravation lying down. So all these symptoms are related to, and where there is a lot of tightness to the left side of the chest. Moreover, the affection would be left side of the chest. So that is about Sumbul, bhai.
So Sumbul is a heart remedy, first of all, and which has been used for cardiac asthma. Yes. Typically, they have, and Sumbul is another remedy for sleeplessness in drunkards. And it has worked wonderfully. And who has a history of chronic alcoholism and who has a sleeplessness plus cardiac involvement plus asthma history, Sumbul.
Yes.
And that's why in asthma it is compared with Lactuca virosa, which is another remedy for cirrhosis of liver also. Lactuca virosa.
Lactuca virosa.
Yes.
This is by Symphytum.
Of Symphytum, to haddi jod, knit bone, we can call it. Symphytum has been written excessively painful old injuries. So all the old injuries which has lot of pain, remnants of pain, where it remains, the pain remains, irrespective to periosteum, cartilage or bones. Definitely think of it, especially comminuted fractures. Where comes Symphytum? Recently there was a case of fracture in a shoulder, and the bones were intact. It was not here and there, but there was a hairline crack. I gave Symphytum, went to 10 to 15 days, everything got magically disappeared. So that way Symphytum is, especially when the bones are very slow to unite, you can definitely think of Symphytum very well. And even if there is like Dr. Kadambri rightly said, the blow bruise on the eye socket, yes, like in my early days, in my BHMS, my junior got hurt by a tennis ball straight away in the eye, and this whole eye was sore, and we gave Symphytum 200 frequently, and he got well, like 2 to 3 days, he was absolutely well. So that way it has worked beautifully. So last.
Last. Again, a very, very big remedy, Syphilinum. उसके बारे में अच्छा 5 ही पॉइंट बताना है, ज्यादा कुछ नहीं बताना है. आप 5 पॉइंट बताओ तो मैं समझ जाऊंगा कि वो 5 सबसे इंपॉर्टेंट पॉइंट्स होंगे. चलो, we'll wind up it that way.
Anything asymmetrical in the body falls in the category of Syphilinum. Anything so asymmetrical, congenital, night aggravation, chronicity of complaint where no remedy is responding, that is Syphilinum. And mainly all the strictures which are not responding, any type of strictures, any history, that is you can think of Syphilinum. तो सर 5 पॉइंट्स यही है जो मेन मैंने बताया.
मोस्ट इम्पोर्टेंट जो हमको आई गेस आलोक सर ने बताए थे, कॉस्टिकम के बाद नाट्रम सल्फ के बाद सिफिलिनम, बेटर बाय चेंजिंग पोजीशन व्हिच इट शुड बी हाईलाइटेड। तो एडवांस पैथोलॉजिकल केसेस है, लीनियर अफेक्शंस के लिए सर ने हाईलाइट किया था कि अगेन वेरी स्ट्रॉन्ग रेमेडी फॉर लीनियर अफेक्शंस, लीनियर वार्ड्स, लीनियर, तो उसमें थोड़ा एडवांस जाना चाहिए कि पैथोलॉजिकल कंडीशन थोड़ा ज्यादा होगा। एंड वॉइड्स यूरिन बेटर बाय स्टैंडिंग, ये चीज को उन्होंने उस टाइम पे हाईलाइट किया था। तो सेकंड सिफिलिनम asymmetrical, elaborate please, parag matre पूछ रहे हैं, is asymmetrical, what do you mean when you say asymmetrical? Asymmetrical means my friend when you have an advanced pathological case, and जब सर ने बताया था कि symmetrical बहुत बार केसेस में सिमेट्रिकल चेंजेस होते हैं। रस्टॉक्स में सिमेट्रिकल आप देखोगे कि टीनिया आता है, सिमेट्रिकल आता है, दोनों साइड पे सेम आता है, तो इसमें आएगा तो एक साइड पे आएगा, तो दैट इज व्हाट asymmetric means. Dr. Shiv Prasad is saying pouty lips.
Yes, I would add asymmetrical में face एक तरफ align नहीं होता, तो जो आगे तो ये पीछे, yes. Which is not one shape, cleft palates, all the congenital hereditary, yes. High arc which is abnormal ना, high arc बहुत कम लोग का होता है, तो face से पता चल जाता है कि he has a syphilitic trait in his face. So Merxol, nitric acid and Syphilinum fall in the category of their complaints, which are very, very syphilitic. Yes. So, and especially there are extremely hot patients of Syphilinum, but their complaints, skin complaints get better by hot bathing. So that way it contradicts. And any remedy which you give and it is not responding and the patient has night aggravation, आँख बंद करके you should give Syphilinum 1 dose and you see the effect. You will definitely find it, because nowadays most of the cases you are treating, it is all becomes of chronicity of complaints and not responding to the well selected remedies. In that case, Syphilinums come to the rescue very well, because that way Syphilinum actually opens the case and helps the patient. Whether it's cancer, whether it's any rheumatic pains, whether it's RA, whether it's vitiligo. Vitiligo also, let me tell you, Syphilinum has helped me in many cases of vitiligo. I have cured
the cases. Yeah, you can. Yeah, since the beginning आप vitiligo में use कर सकते हो, आपने मुझे भी बोला था।
हाँ, yes, so because Syphilinum इतना deep है और Syphilinum के बाद भी अगर vitiligo में अगर results नहीं आ रहे, तो you can think of X-ray. Dr. S.P. Day ने लिखा था in vitiligo where the cases which are not responding. S.P. Day was a direct student of Dr. Fobister, who has a prover of carcinosis. So S.P. Day ने लिखा था regarding of X-ray. X-ray can be used in chronic leukemia and also in vitiligo cases. So in blood cancer cases as well as the vitiligo cases, where it has actually helped to stimulate the vital force, you give as an intercurrent in those cases. So Syphilinum X-ray has a wonderful role. Also, there is a remedy for vitiligo, anterior pituitary glandula, and petorhinum. These have actually helped in most of the stubborn cases of cases. And yes, rightly said Dr. Kadambari, Sol. So Sol, when you think where there is a photodermatitis ka example ho, ya who has a problem with sun rays and everything, so even radium bromide comes in that category also. And atopic dermatitis which aggravates by sun rays. So this way it is. And Rahabat Syphilinum, they have all the pain in the tibias, night pains, and typically what happens, Syphilinum patients are very much hopeless. They are like sitting, yes, ठीक है, हो जाएगा तो ठीक है. They are very much despair. They have despair attitude. You will see they are not very much positive with their complaints. So their mental sphere is very much destructive. That replicates with the complaints also. So you will see if vitiligo also it is vast. So you will pain also, it's very vast. If they complain also, they will right. And yes, rightly said, the family history of alcoholism is very marked in Syphilinum, especially if the alcoholic father is born to a child and who has a congenital deformity. Straight away you should think of Syphilinum. So that way it is. Syphilinum, what to say? Syphilinum is a everyday remedy now, because in practice when you see so much of vast picture of complications and so much of polypharmacy done already, what to do? And then these nosodes come to the rescue. Yeah. By either Meadow, either Syphilinum. So, sir, thank you so much.
आपको थैंक यू, इतना अच्छा सेशन. आई थिंक सबको बहुत मजा आया, सब लोगों ने बहुत एंजॉय किया. एवरीबडी, वी ऑल वांट टू थैंक यू फॉर कमिंग सेकेंड टाइम. हमारे इसमें सिर्फ 2 ही लोग 2 बार आए हैं. एक रंजन दा को 2 बार बुलाया था, एंड एक आपको दूसरी बार बुलाया है, आपको भी जबरदस्ती करके मैंने इसीलिए बोला कि नो नथिंग डूइंग, आप रात को बिजी हो, हम दोपहर को कर लेंगे, वैसे भी ये सेशन यहाँ पे होता है एंड हम बाद में लोग जिनको देखना है देख लेंगे, तो आज रात का सेशन नहीं होगा एंड आपको दोपहर को हमने परेशान किया, आपके
नहीं
बिजी
नहीं सर,
शेड्यूल में आपने
कोई
एक
पता
घंटा
नहीं,
निकाला।
नहीं नहीं, थैंक यू, और ऐसा कुछ भी बात नहीं सर परेशान का, आप जब बोले तब हाजिर हैं। अगर if we share something and something gets well acquainted with all the students who are here, I think that is the best blessing what we can get. And I'm very grateful to each and everyone whoever joined this session and actually shows your interest to be a better homeopath, to be with us, because what here we are trying to say is we are sharing most important points which are actually missed in a clinical point of view, and we like to add that don't miss these kinds of points, because बुक्स पे जो लिखा रहता है वो बुक्स ही वाला जानता है, बट जो डेस्क में हम लोग बैठ के देखते हैं, दैट वी कैन एक्चुअली शेयर व्हाट हैपेंस हियर इन द क्लिनिक. सो दैट्स व्हाट एक्चुअली मेंस अ लॉट व्हेन यू शेयर योर ट्रू एक्सपीरियंस विद द रेमेडीज, बिकॉज लिखा तो सब कुछ है ना, बट एक्सपीरियंस कहाँ है, दैट्स व्हाट मैटर इज. Because many times, because in my initial days I used to practice ETs and everything and drastically fail, so I understood very late that what actually means that unless and until you see more patients, more knowledge, more Medica experience can actually help you to become a good practitioner. That's what it is. Rather doing you can say many people get confused कि Materia बहुत hard है, but आप खुद उस तरीके से नहीं पढ़ रहे हो तो hard लगेगा ना.
So इसीलिए the very purpose of starting this marathon series was to, because आप हैं, रंजनदा हैं, बहुत हमारे सारे स्पीकर्स ने ज्वाइन किया, तो कुछ चीजों को हाईलाइट किया, कुछ हमारे सीनियर्स भी इसमें आते हैं, कुछ हमारे सेम एज ग्रुप के हैं, कुछ सारे जूनियर्स आई गेस ज्यादा ही हैं, तो उन सबको एक बेसिकली एक क्लैरिटी मिलता है कि क्या करना है क्या नहीं करना है, एंड सेकेंडली घर बैठे बैठे पढ़ाई हो जाती है.
नहीं सर, वी आर grateful that you actually thought about for every student, and we are very grateful that you started this actually marathon, and I think the end of this marathon will be a blast. And
एंड वी आर एक है कि बस अभी एक ही सेशन होने वाला, दो ही सेशन होने वाले हैं, सबको बता देता हूँ. एक अभी TS हो गया, अभी T होगा, UV, ये सब छोटे रेमेडीज हैं, तो उसके लिए ग्रैंड मैराथन होगा, बहुत सारे स्पीकर्स आने वाले हैं, सो यू ऑल स्टे ट्यून्ड. देयर आर ओनली 2 सेशंस लेफ्ट नाउ, वन विल बी T एंड देन विल बी, दैट्स इट, वी विल बी वाइंडिंग अप आवर मैराथन सीरीज एंड देन वी विल हैव अ नाइस ब्रेक. सब लोग मेरे स्पीकर्स भी, जिनको मैं बार बार मैसेज करके परेशान करता हूँ, आ जाओ, मैं खुद, मेरे घर वाले, सब लोग शांत हो जाएंगे, and then we'll see how we connect once again. So this last 2 sessions now. Thank you all for connecting. We'll see you all soon once again. Thank you so much.
thank you so much. Thank you.
Bye.